Hi, my name is Sam, and I'm one of 3 Princeton undergraduate students who, along with a student from Michigan State University, served as research assistants at the Institute for Empirical Research in Political Economy, otherwise known as IERPE, in Abomey, Calavi, Benin, in West Africa this summer. IERPE is the partner institution of the African School of Economics, which provides MBA and MMES degree programs for students from all over Africa. Our role at the Institute this summer was to provide assistance on an emerging research project on road accidents. The primary goal of our project was to produce a comprehensive summary of the current challenges to road safety in Benin. This included statistical analysis of data from Benin's Centre National de Sécurité Routière pertaining to the determinants of road accidents and road accident fatalities in the country. Additionally, we began work on a study that will aim to create a more vivid picture of the emergency care system in general in Benin. This will involve a survey that will be administered to both healthcare providers and patients that will gauge the efficiencies and challenges of the current emergency care system and seek to identify areas of improvement. Thus far, only 65 surveys have been administered, but ultimately the study will aim to assess the emergency care system as a whole in Benin. In order to gain a fuller understanding of road safety in Benin, ASE students Gilles-Christ Tuhuenu and Tilu Sunja shared their thoughts with us about the current situation.
So, Chris, Tilu, how would you describe traffic in Benin?
Traffic is like people are driving as they want. They are passing themselves for as they can, and also there is more accident in that time. But since this law is coming now, so motorcycle one side and car on another side, so the traffic is more good.
How often do you wear a helmet when you ride your motorcycles?
At the beginning, before the law, we do not wear it because we think that is like sometimes you get head pain. See, because we were not used to it. But since they say that they will arrest us, and those kind of things, we start using it. And I think that now we are used to it, and with that, it's more safe.
And when you ride with him or with someone else on the back?
At the back,
Okay.
I don't really. It's not normally it's compulsory to wear the helmet, but they are not arresting people at the back who do not wear it. We heard that for the helmet, they just wanted to sell a lot of helmet. That's why they brought that law. They start arresting people, but after maybe some month they stop.
Have you guys ever been in a motorcycle accident?
Yeah, we had an accident around December.
Have most of your friends also been in accidents?
Yeah, we had Elise also had an accident last time.
But he get
He was hurt, but not something really special. Yeah.
Hi, I'm Rachel. To gain additional background information on emergency care and the public health system as a whole in Benin, we initiated contact with several different organizations working in the public health sector in the country. We spoke with individuals working at UNICEF, the WHO, USAID, and Population Services International. From these meetings, we gained an understanding of the organizational structure of public health work and interventions in Benin, and the extent to which each of these organizations focus on and are involved with emergency care and road accident prevention and treatment. Beyond our work on the Emergency Care Project, we also participated in a summer school program that ASE hosted for individuals working at partner organizations of Afrobarometer. The Afrobarometer is a series of surveys used to gauge the sentiments of people in different African countries regarding democracy, markets, and civil service. Data from the surveys allows for comparative studies between public attitudes on these themes in different countries. As part of the program, individuals from all over the continent came to Cotonou for 3 weeks to take part in training in SPSS, a statistical software, and presenting their research related to the Afrobarometer. We enjoyed attending classes at the summer school and learning about the different types of research people around the continent are working on.
My name is Luise Zhong, and I'm going to be a senior in the economics department. Our research on road accidents was the primary focus of our internship, but IERPE also works on multiple research projects at once. The side project that I got to work on was on social mobility among the first students of Catholic schools in Benin and their descendants. My job was to provide a researcher with insights on the data, to play around with the data and create new variables appropriate to our goals, to think of and execute methods of measuring social mobility given our data, and to find relationships between social mobility between generations and risk aversion as well as mental health. Our research was for a companion paper to one that was published earlier on the effects of the first schools in Benin on both descendants of the students as well as indirect effects on non-students who lived close to the schools. Ultimately, we hope that the work we have done on both road safety and social mobility will have an impact on future conditions in the country and can lead to further important work.
La bébé doit fils